Good afternoon, everyone, and welcome to another social emotional workshop. We are here today with Henry Ford Health Systems, Lisa Kaplan, and we're going to be talking about depression and how to deal with it and how to recognize it. Welcome back, Lisa. We're so glad to have you.
Thank you. I'm happy to be here, and we're actually talking about depression and anxiety.
Indeed, indeed.
Okay, should I get going?
Absolutely.
Okay, so what we're going to talk about first is what is a mental health condition? If a mental health condition affects a person's thinking, feeling, or mood. And these conditions may affect someone's ability to relate to others and function every day. And each person will have different experiences, even people who have the same diagnosis. So how is it determined if a person has a mental health disorder? Well, there's a book that some of you may have heard of if you've ever had a psychology class. It's called the DSM, Diagnostic and Statistical Manual, and now they're on volume 5. And what it is, it's a book written by a group of psychiatrists and updated every 10 to 15 years, and it lists all the substance use and mental health disorders and the criteria or the symptoms needed to meet the diagnosis. So for example, it might say you have to have 5 of the following 10 symptoms for 2 weeks or more to meet the criteria. So every substance use disorder and mental health disorder is listed in that book. So before they even diagnose a person with a mental health disorder, you need to rule out a physical problem, because very often physical problems can mimic mental health symptoms. But assuming that they've ruled out a physical problem, then they may diagnose someone with a mental health disorder. And today we're talking about anxiety and depression. And both of these diagnoses, you may or may not know, are highly genetic, meaning they run in families. There's no guarantee that if anxiety runs in your family, that you will be diagnosed with it, but it certainly increases the odds. And same with depression. But there's other things that create these problems. It could be a traumatic event, and trauma, of course, means different things to different people. We think of typically, or you do in the education field, childhood, sexual abuse, physical abuse, neglect. But trauma could mean having your parents go through a contentious divorce, or watching your house go up in smoke, or seeing your dog, get hit by a car. So traumatic events can trigger anxiety and depression. So can life circumstances. So being in an environment where there's high crime, being where you feel unsafe, a lot of poverty, that can trigger it. And also brain and hormonal changes can trigger anxiety or depression. And absolutely any substance use disorder, alcohol and other drugs, often go hand in hand with anxiety and depression. So let's talk about some statistics to see how common this is. 1 out of 5 American adults experience mental illness, so 20%. And about 17% of youth ages 6 to 17 have experienced a mental health disorder. The reason they start at age 6 is because most people are not diagnosed much younger than that. So about 8% of American adults experience depression, okay, 8% at any given time. So let's talk about anxiety. What is it? Well, we all feel anxiety. Anxiety motivates people. So let's say that we have to give a speech in front of a group, or we have to drive in traffic. A little anxiety helps us to prepare and to do a better job. Okay, it motivates us in a positive way. It's a problem, though, when anxiety becomes intense and it causes fear or distress. It can be overwhelming, and it can prevent us from doing everyday activities. And if that's the case, it's a problem. So there's multiple types of anxiety disorders. They're all listed in the DSM-5 if you want to look them up or Google them. But there are a whole bunch of emotional symptoms, and I'm going to read some to you. So feelings of apprehension or dread, feeling tense or jumpy, restlessness, irritability, anticipating the worst and being watchful for signs of danger. And then there's physical symptoms like pounding or racing heart, shortness of breath, sweating, tremors, twitches, headaches, fatigue, insomnia. It's also common to have an upset stomach, frequent urination or diarrhea. So there are multiple types of anxiety disorders, and the symptoms vary from person to person, but they also vary according to a person's diagnosis. So the most common one is generalized anxiety disorder, also known as GAD. Okay, so you probably know many people in your life who have experienced this, because I don't know if you're aware, but anxiety is the #1 mental health disorder. Okay, you might have thought it was depression, but truly anxiety. And for some people, anxiety and depression often go hand in hand. So what is generalized anxiety disorder? It produces chronic, exaggerated worrying about everyday life. The worrying can consume hours each day, making it hard to concentrate or complete daily tasks. A person could become exhausted by worry and experience headaches, tension, or nausea. So typically, it's people who feel unsettled and unable to relax and uncomfortable in their own skin. Okay? They're on edge for no particular reason. It's not because a snake is coming at me. Okay, it's not because, somebody's aiming a gun at me. This is a general feeling for no particular reason. Okay, so people worry a lot. So if you know people in your life who are worriers, or you're working with children who are worriers, it is very possible that they have a generalized anxiety disorder. So, another type of anxiety disorder is a social anxiety disorder. And we saw this a lot before the pandemic, but I'm pretty certain that if this pandemic ever lifts, we're going to be seeing this more and more, because people oftentimes, especially kids who are homeschooled or working, virtual, they're not out in public, they're not out socializing. So their skills may be either undeveloped, underdeveloped, or rusty. So I'm sure that we'll be seeing more of this. So social anxiety disorder, many people think that that just means being shy. It's not just being shy. This disorder causes intense fear about social interaction. It's often driven by irrational worries about humiliation. So someone who's fearful that they're going to say something stupid, or that they're going to be asked a question and not know how to respond. So someone who has social anxiety disorder may not have the skills to take part in conversations, to contribute to class discussions, to offer their ideas. And what happens is they withdraw and become isolated. And what commonly happens to people is they develop panic attacks, which we're going to talk about panic disorder. But a panic attack is incredibly frightening. Okay, people feel like they're having a heart attack, or they're going to die. Something horrible is going to happen. So they get shaky, sweaty, nauseated. There's this impending sense of doom, increased heart rate, increased body temperature. It's very, very frightening. And it can last for several minutes. So a severe social anxiety disorder can lead to a panic attack. And then there's panic disorder. Okay, this is frequent panic attacks and sudden feelings of terror, sometimes repeatedly and without warning. So it hits you and it seems to come out of nowhere. So again, people feel like they're having a heart attack. Chest pain, heart palpitations, dizziness, short of breath, etc. So what happens is, this is a very frightening thing to experience, And nobody wants to experience that, of course. So what do? If they isolate socially and they limit their interactions with the world, they feel safe. So very often people will stay home or stay in one part of their house where they feel like they have control over their environment to avoid the really uncomfortable symptoms of panic disorder. And another one we're all familiar with are phobias. Okay, so phobias, people tend to avoid certain things or situations that make us uncomfortable or even fearful. So for someone with a phobia, certain places, events, or objects create a powerful reaction or strong irrational fear. Okay, so most people with specific phobias have several things that can trigger this reaction. And to avoid panic, they're going to work hard to avoid their triggers. And depending on how many triggers and how severe they are and the type that they are, the attempt to control the fear can take over a person's life and then again cause them to isolate. So I will tell you, I'll tell you my own personal experience. I have a fear of dogs. It didn't come out of the blue. Okay, when I was young, I was attacked by a neighbor's dog. I was attacked by a dog at a friend's house. And then as an adult, I was attacked by a dog at a softball field when I wasn't even moving. I was just sitting there. So I have a fear of dogs. Okay, there are people who fear other things. I have family members who fear bridges. Why? Because their mother feared bridges. Okay, so people can become fearful of things through learned experiences, or sometimes they don't know what triggers it. They don't know. Many of us, if there were a snake loose in the room, we'd all be having some type of fear. Most of us would. Now, that might not have come from anywhere. That might not have come from childhood. Maybe nobody was ever attacked by a snake. So it's not necessarily triggered by something we know or something identifiable. So those are the main types of anxiety disorders, but there's others. Have you heard of agoraphobia? That's people who have a difficult time leaving their house. And some people can't even walk to the bottom of their driveway to get the mail and come back. Okay, it's pretty severe. So the definition is really fear of being alone in open places. So going to a mall or going to, Comerica Park with someone who has agoraphobia probably isn't going to happen. And there's selective mutism. My daughter had a friend in preschool who would not talk except with her family. She got treatment for that and is doing very well as a young adult. Separation and anxiety disorder, oh my goodness, it just escaped me. Separation anxiety, what babies experience as they grow. Most of us who had children know that when somebody strange enters the room, they might cry. If a babysitter comes over, they might have a hard time. And then there's substance-induced anxiety disorders, and I'm going to say most of them are. People who use alcohol and other drugs, it could trigger anxiety, or when the drug wears off, or when they're detoxing off of a drug, that can create an anxiety reaction. So there's many different types of anxiety disorders. So now let's talk about depression. Some of you may have heard the term depression, but the real medical term that's listed in the DSM-5 is called major depressive disorder. And this is more than just being sad, okay, or just going through a rough time. If we got a cancer diagnosis, or our dog died, or somebody in the family was, getting divorced, we'd be sad, okay? But that's not what major depressive disorder is. It's much more severe than that. So the symptoms of major depressive disorder are extreme sadness, loss of interest or pleasure in activities, eating too much or eating too little, sleep disturbances, sleeping too much or sleeping too little, feeling agitated or slowed down, fatigue, low self-esteem, focusing on guilt or shortcomings, trouble concentrating, trouble understanding, trouble remembering, and trouble making decisions, suicidal thoughts or attempts, and many other symptoms. So this can be a very devastating illness. Okay, very devastating. However, it is also very treatable. Depression is one of the most treatable illnesses there is, and successfully treatable illnesses. What we see where I working in the field of addiction, is many people self-medicate anxiety and depression with substances, which helps initially, and then it stops working and it makes things worse. So treating a person, or treating yourself with alcohol and other drugs is not at all helpful. So there's many types of help for people who have depression and anxiety. So what we're going to talk about are the different types of healthcare providers who provide services to help people. A psychiatrist is a medical doctor who specializes in diagnosing and treating patients with psychiatric disorders. So these are doctors who have gotten additional training. And today, psychiatry has changed. They do evaluations and medication review. That is not the same as doing treatment or counseling or therapy like they did back in the day. There's a severe shortage of psychiatrists. Okay, so a good evaluation should evaluate the person in front of them as well as the family history, because we talked about how highly genetic these diseases are. So that would be evaluation and medication review. They will write you a script for a type of psychotropic medication and tell you to come back in a month and say, try it out, let me know how it went. Okay, that's not therapy. Okay, so psychiatrists have a really important role, but they're not therapists. So who would people go to for a therapist? Well, they're either going to see a psychologist, a social worker, or a licensed professional counselor. And all of these people have master's degrees and a license in the state of Michigan or wherever they're licensed to do what we call treatment or counseling. They cannot prescribe medication, but they can work in conjunction with a psychiatrist to help a patient if a patient signs a release of information form allowing what we call continuum of care, allowing professionals to talk to one another on their behalf. Okay, some medical doctors are primary care physicians, might prescribe medication, although they're not the experts on mental health medications. And then there's people who have a PhD or a PsyD degree. You've heard of those, of course. And we all know you can have a PhD in chemistry or in Spanish, but that's not what we're talking about. We're talking about PhD in the field of clinical psychology. And those people can do psychological testing as well as therapy or counseling, but they cannot prescribe medication. Okay, so those are the types of mental health professionals. And now, how do you find one? Insurance companies have a list of people who are paneled with them. And they'll give you a list of names and numbers, but who are these people? And are they any good? We don't know. You can also Google them. You can go on sites like Psychology Today and you will get a whole list. But again, who are they? Are they any good? So some people would then read the Google reviews, but how do you know that it's not the therapist's mother and her 10 best friends writing the reviews? You really don't know. So the best way of getting a good recommendation for a therapist is to get recommendations from people you trust. Could be family or friends, could be your primary care physician, could be a school counselor, okay, who may have a relationship with people in the community. And every therapist has different strengths and weaknesses. Who I like, you may not, because we're different and we're looking for different things. But a person who selects a therapist really needs to click with the therapist. So there's different types of therapies and people specialize in different things. Talk therapy is usually called psychotherapy. but there's a whole bunch of different types of treatment. There's transcranial magnetic stimulation, which is fairly new and used for people who have very, very stubborn depression. ECT, electric shock treatment, is something that has been around for a very, very, very long time. Of course, they have upgraded the skills that they used many years ago, so it's much more effective than it used to be. Light therapy, you may hear of people who have seasonal affective disorder, especially during the winter months when there's no sunlight, they become really down. So there's special lights that they can use. There's all sorts of different complementary therapies, alternative therapies, yoga, things like that, stress and relaxation techniques. There are just so many different types of therapies that can help people. Acupuncture, meditation, faith, nutrition can all be part of a comprehensive treatment plan that will help people to overcome depression and anxiety. So now we need to talk about COVID. How has COVID added to this problem? And I'm going to say astronomically. My friends who have private practices, they're therapists in private practices, their businesses are booming. I can tell you that psychiatric hospitals are full. I can tell you our psychiatric hospital through Henry Ford is full and dealing with COVID. We can't turn people away because of having COVID. I will say that the amount of alcohol and other drug use has skyrocketed since the pandemic started. As you may or may not know by being in the education field, so many students, so many kids are really struggling with depression and anxiety, as are their parents, who are incredibly stressed out from either losing jobs, working from home, dealing with virtual schooling as schools come in and out of in-person learning. So COVID has really caused a huge issue. So it is said that the results of COVID from a mental health standpoint will continue for 3 years after the pandemic ends. So we'll be dealing with this for a very long time. So if you think that you are struggling or anybody you know is struggling, there is help out there. But the earlier you get help, the better. Early intervention is the key. And of course, if anybody in your life is having any suicidal thoughts or suicidal attempts, you absolutely want to talk to them about it. Asking someone, are you having suicidal thoughts, will not plant the idea in their mind and have them pursue suicide if they haven't already thought about it. But when you bring it up, when you talk about it openly, number one, it gives them permission to talk about it if they choose to. It normalizes the experience, and you could be saving a life. So you don't want to, if someone talks about suicide, you don't want to say, no, don't tell me, I don't want to hear it. You want to say, tell me more, tell me more about this. How are we going to get you help? Okay. Same thing with kids. There are kids who are suicidal as well. And as kids are struggling, you want to look for that in your students as well. There are some schools who don't want teachers or counselors using the word suicide, very frightening to bring that up in a school setting for some of them, because they're afraid that you're going to open up a can of worms that you can't then close. So rather than using the word suicide, asking, have you thought of hurting yourself in any way? Okay, that's less scary language. So with that, I think we will open it up to any questions or comments about the whole issue of mental health, anxiety, depression. I feel like I whipped through that pretty quickly.
You guys, if you want to type your question in or raise your hand and I'll unmute you happily, please let me know.
So let me ask you this. Are you seeing any signs of depression or anxiety in your students?
I would say absolutely yes. A great deal of them are very anxious and nervous and concerned about what's going on. in their households and their families, with their education. And then on the opposite side of that, we have students that are just, opting out and not participating.
Mhm. Opting out meaning closing down, shutting down, or dropping out.
Closing down, shutting down.
Yeah.
Joseph says that he agrees with what we're saying, that a lot of his students are really anxious right now. Joanne is saying that she has students experiencing a lot of deaths. Yes, there have been a lot of deaths in a lot of our students' families and a lot of our families as staffers. I lost my mom in June, so.
Sorry. Yeah. So can I give you, so I'm going to be talking to you about stress at a later presentation.
Yes.
And what we're going to do is we're going to do some really interactive activities that you can do with your students to teach them relaxation techniques, stress management techniques that really do work with anxiety. So that I hope that you will all attend that day. I don't have a date in front of me, but I will be teaching you what we teach our patients, and it really does work. And then you can then in turn teach your students.
It's
And
next Tuesday.
Next Tuesday. Okay. And maybe hopefully what'll happen is the students will then go home and talk to their families about what they've learned, and maybe then help the whole family.
Tammy has typed in the chat box that a lot of her students are online because they have panic attacks and anxiety at school, especially after dealing with the situation in Oxford,
Yes.
And not just Oxford, because it's across the country. And
Right.
unfortunately, when it happened for us in Oxford, my thought was, oh my God, they just had to have one here in Michigan,
Yep.
and that is something that is very, concerning for staff and students, because each day you go to school, you don't know whether or not it will be one of those incidents where you'll have a situation like that and not go home, or go home injured because, and so these are thoughts that affect every one of us, and it affects how we approach and do our job. It affects how we function as a student. It's hard to expect them to be able to pick up where they left off and just start, working away,
Right. So some of the relaxation techniques and techniques that I teach you on Tuesday, you could start school that way. Okay, you could start before they do anything academic, do some type of relaxation to clear their mind and then get them to focus on schoolwork. But educating them that you can do this anytime you want. So anytime they're having trouble sleeping at night, or they hear something on the news that's really upsetting, there are things they can do to help themselves. And one thing that they should be doing is not watching the news.
So you feel that limiting your media or your news intake.
Yep. Limiting exposure. So I'll give you an example. Before the presidential election in 2020, I was completely overwhelmed with all the negative ads for candidates. And I finally decided, why am I watching this? I cut it down. I shut it off. And you know what? Within a day, I felt better. So kids should really not be watching the news if it's going to be, this stuff. That doesn't mean you don't want to talk to them about it, but you certainly want to filter what kind of information they're getting. And I can say from my own personal experience, when my children were young and 9/11 happened and it was on TV over and over and over again, they thought it kept happening. They thought airplanes were crashing into buildings for days, because in a child's mind, that's what they thought. So even though it does happen frequently, and it did happen here in Michigan, we don't want kids to think it's happening every single day in many, many schools, because That's not reality, at least not in the same state every day.
Good deal, good deal. Do you guys have any other questions or comments that you want to share with us?
Well, I hope that you will all come on Tuesday, because I think that I'll be able to share with you some things that you will really appreciate learning, and they'll help your kids.
Go ahead, Tammy.
Okay, I was just gonna say that as a success coach at my virtual, most of the kids that we talk to and the things we get are about anxiety, depression. So thank you so much for your information, because it really gave me a lot to think about. And I really am looking forward to that stress one too on Tuesday.
Yeah. It'll be helpful to you personally as well.
Good.
Indeed.
Because-
Again,
yeah.
like I said, as staff, we're like, oh my God, seriously, you know.
You guys are experiencing secondary trauma by hearing from your students, what they're experiencing. And you're probably, after all this time, probably also suffering from compassion fatigue.
Yeah.
So, yeah, it's not easy. Thank you all for what you do to help students. They're very fortunate.
Good deal. Anybody else want to share before we bring this to a conclusion? Okay. Well then, thank you so much, Lisa.
Hey, you're welcome. I will see you on Tuesday.
Absolutely. We look forward to it.
Okay, take care, everybody.
Bye, everybody. Thanks for tuning in and have a great day now.